as we get started is this is going to be a moderated session, so we do have polling questions built in throughout the presentation, and we do have a live website demo that we want to share with you and show you. We're super excited about this because we're launching, you're having really the first time the opportunity to see a new system being put up, and as well as a new adaptive education module that will be available for all healthcare professionals as well as simulationists. But questions will be available throughout the chat. So if you have a question that pops up, please feel free to put it in the chat. And then if you're interested in joining us on the poll, as well, and just putting in the join, it says join username will be Clo Healthcare as well, right? So thanks so much for being part of that. So as Judy mentioned, my name is Amar Patel. I serve as the Chief Learning Officer at CAE Healthcare. I've been in simulation for well over 20 years. I had the opportunity to be beta testing a number of the firsts in the simulation industry mannequins, and certainly be involved in a lot of the new development of curriculum and content over the years. So I'm a big advocate on medical education and innovation and research. I've had the luxury over my tenure to be part of the academic side, largely in the healthcare system side, and now moved into the industry side over the last 2 years. My background is as a paramedic. I grew up as a flight paramedic in an emergency and worked for Baltimore County Fire Department for a number of years. But I'm actively involved in the Society for Simulation in Healthcare. I chair the Internal Relations Committee. I'm on the Board of Governance as a fellow. And I'm also the incoming chair of the corporate roundtable. So heavily involved in a lot of the society's work. Dr. Jamal?
Yeah, so met Amar nearly 20 years ago when doing simulation as well. So we'll be happy to walk you through some of the underpinnings of adaptive learning and how it can be used in combination with simulation as well as isolated. I've been working in this area for, as I mentioned, nearly 20 years. I started as a medical student, but very early on in my early 20s, I got caught in the with curiosity into what simulation could do to uncover and unfold what we call unconscious incompetence. And we'll talk more about that. So knowing what you know and what you don't know. But happy to join the meeting today.
Thanks, Karen. Thank you. Kelly?
Hello, thank you for having me on today as well. My name is Kelly McCready. I'm with the Area 9 team also, and I'm on the Enterprise Solutions Architecture team at Area 9. Have been with our business for 3 years and work with our partners to help deliver education, including education and simulation across various healthcare sectors. So very glad to be here today and looking forward to the conversation.
Thank you so much. So I think, it's important to highlight a couple different things, right? And I'll let you guys get ready as this poll question loads. CAE and Area 9 group partnered together to ensure that we were able to offer really unique digital content to really the entire market, right? Our hope here was to meet and combat the needs of the COVID crisis that was present. And early on in this journey, there was a gap that was identified in the COVID world for mechanical ventilation. And the two of us really collaborated strongly together to be able to develop and deliver education out in the larger community. So, today we've had over 3,000 people complete an adaptive online education program. Our hopes is to continue to push that forward, but to share this idea of adaptive learning and the impact adaptive learning has on really driving competency for your own individuals, and for you as an educator, for your learners who are tasked with really meeting the demand of this growing and changing environment, and the fact that all of us are living this unique structure of being home, away from the classroom spaces, or being in the classroom setting only at a certain period of time. How do we ensure that our learners are really taking something away from them? And I think it's important for us to really understand that journey and the challenges we face and where adaptive will drive that really to the next step. So, we're kind of curious straight out the gate. Where are you from, right? We're really interested to understand what parts of the world are joining us today, and certainly seeing the impact it has, because every place on the map has a bit of a different journey. You have different rules, you have different regulations, you have different processes, but every bit of that journey is unique for you. Our hope is to be able to help you craft that journey, create something that is content rich, content neutral, but at the same time is impactful, and doesn't create too many challenges for you down the line. And we hope that what we share with you today is unique and impactful and powerful. We're going to show 7 different, we'll highlight one module, but we'll show the fact that there's 7 different programs that that will launch today with you guys. And what's important here is that, and we're excited about this because this won the EMS Innovations Award, and we're super excited because it also won the EMS Users Choice Award when it was highlighted at the EMS World Conference last month. So for us, it's extremely exciting because, you know, this is over 3,000 attendees that attended the conference that chose the adaptive learning element as a core element to driving proficiency and education forward. At the same time, we're kind of curious, are you currently using any adaptive learning technology in your educational program? Although I just noticed a spelling error there, Kelly. We missed it. So we're about 50-50 so far. Oh, getting there. So, you know, certainly somewhere in the middle, right? So for the folks, you know, we'll talk about this. For the folks that are truly using adaptive learning, you know, one of our questions that will certainly come up is, what are you using? Is it a homegrown item? Have you partnered with somebody to create that content? Is it an AI engine in the background that's really driving that forward? A part of us is creating this technology-rich environment that's such pivotal in the journey forward to make sure that you have accurate information available to you in real time and your students are learning. And there is a difference, and Karen will talk about it, there is a difference between adaptive testing and adaptive education or adaptive learning in nature. So great. So 50% not sure, 31 and 19. So thanks for sharing. It's great. So as we think about this, I think to normalize the playing field a little bit, let's define adaptive learning, right? So if you look at the second edition of the Society for Simulation in Healthcare dictionary, you'll notice that adaptive learning is defining a wide range of technologies and techniques. Not only does it observe individual learners, but the content in that is adjusting in real time to the demand to meet the unique needs of the individual learner. So the participant is getting real feedback in real time, is understanding the challenges, and the system is adjusting to that in real time to ensure that they're getting what they need to be effective. And I think it's also important for me to highlight the 3 elements that drive effectiveness across the board, right? So a single solution in this unique world is not going to give you the end all be all, right? There is no magic window that's there. So online training, right? Our hope is that you're leveraging online education that is adaptive in nature and driven for driving competency forward. We're hoping that you're using some level of augmented mixed reality in the mix of that. And then we're hoping that you're using simulation, right? So whether this is virtual instructor-led or full-on in-person simulation, my hope is that you're doing virtual then in-person. But the combination of the 3 is what really is important for you. I can teach you a lot of information in an online presence, but application of that information is where it's always a bit more challenging. And when you get into mixed reality and in-person simulation experiences, you're going to see the connections really start to play a pivotal role. But you really do need all 3 for this to be effective. At the same time, consider the pivot. And that pivot is we need to get away from teacher-centered learning and move into student-centered learning, where the learner is really driving the education and the mastery of the performance, right? And this is where adaptive plays that pivotal role, is that it allows for the learner to be able to drive how they know information, how they're able to metabolize information, how they're able to apply that information. And it's extremely important as you make the pivot to understand where those 3 pieces play out. So with that, I'm going to pass this on to Karen.
Yeah, thank you, Amar. And I think in this process of talking about adaptive learning, I think I liked, Amar, that you put up the definition, and it talks a little bit about learning in old terms, what that means. And we have to remember when we talk about AI-driven adaptive learning and these very advanced technologies, that simply what adaptive learning is think about the best professor or teacher you've ever had, that what is it that they're good at? They're good at asking questions. They're good at finding the exact areas where you're weak and where you're strong. And that is what adaptive learning is. The challenge is that it can be hard to scale. And in a COVID era where we really need reliable remote learning, that's why I also think that we accelerated our partnership with CAE, where we saw an immediate and strong need for, we started the first module in ventilator reskilling, and Kelly will walk through some of the next modules that we've launched. And so we love technology, all of us, but I think we have to remember that we're still all humans, and the teacher is, I know, Mama, you mentioned that it shouldn't be teacher-centric, but we're not replacing the teacher, right?
Right,
So we're
correct.
still making it student-centric, but allowing the data that we will collect around knowledge gaps, around what people know and don't know, that will give the instructor actually a stronger role. And I think, and this is obviously not new to the group here at this call, that combining knowledge, skills, and character into a holistic framework, which we will also go through in a moment, is the big opportunity here. And Amar, you mentioned that with the different elements. I initially, when I presented myself, I mentioned about unconscious incompetence. So what do you know? What do you think you know? What you think you know, but you actually don't know it? That's obviously super dangerous in healthcare, right? That's what creates errors, and it's a danger to our patients. So we know that at all levels of organizations, there is some level or a lot of unconscious incompetence. How do we uncover that? What do we do when we uncover that? Should we do more simulations? Should we do other interventions? So that's some of the possibilities that you get when you apply more broadly adaptive learning. I think, can I take over this is where
It's all yours.
the technique, we did practice this.
I'll try now, go for it.
Okay, it's actually not, oh yeah, good. So sorry for that little mishap. So the framework that we will deliver adaptive learning in, either as a standalone course, some of the examples that we'll be showing today, or as a combined modality with simulation. So the knowledge part is not shouldn't be looked at as an isolated adaptive learning course event. It should be combined with those different elements that holistically brings four-dimensional education at scale. So knowledge, skills, character, and what we call meta learning, how we reflect and adapt to what we know and what we don't know. That is what, when we show the live demo, that you will see how that all comes together. I still am not able, yeah, I am. So today, often when we wanna cover a subject, a lot of the time ends up being consumed with knowledge. So the instructor, presenting the knowledge to the students that then needs to go through that in some way or fashion. So the goal with adaptive learning is to basically shrink the time that the learner needs to spend on knowledge with a teacher, and allow them with a self-paced approach to gain the knowledge that they need to, and then allow, in sort of say step 2, to spend more time on the areas that are skills, the character development, and the meta learning. And those, the skills part, are the parts that could be done on obviously in simulation or other ways to attain those skills. But then the knowledge part will be covered by the adaptive learning, providing the data to the learner and the instructors. This is an illustration of a real course and a path of 3 learners. What you immediately notice is that the 3 paths are all different. What you also notice on the different, the sizes of the bubbles are different. That represent how much time the learner has been spending on a given learning objective. So learner 1 clearly raced through in 8 minutes, more or less, through the course, with reaching 100% proficiency with a very low unconscious incompetence level. 3% of the time, she or he thought that they knew the question, but they didn't, or the content. Contrary, learner 2 spent some more time, but the level of unconscious incompetence is a little bit alarming. If 40% of the time, the practitioner, if this is a healthcare provider, thinks that they know what they're doing, that requires some debriefing, maybe some simulation, but at least this data, and when you dwell in deeper into it as a learner or as their instructor, you will probably find some knowledge gaps that needs attention. And learner 3, as you see, 29% of the time, he or she is consciously incompetent, meaning I know that I don't know this. That person is in, I would say, in a learning zone. He or she is open to learn. You can also see this learner has been spending 33 minutes. Now, all of them ends up being 100% proficient, and that's the goal. This aspect of being able to map an organization's or a team's unconscious incompetence also allows you to basically move people from the lower left quadrant up to the upper right quadrant. Is there a question? Sorry, I'm happy to answer. No?
Questions in the chat, Karim.
Okay, super. Can you read it up so I don't, because I can't.
Yep.
The first is that there's a significant upfront cost to develop or enter into a subscription. What would be the ROI for lower costs and time savings? Are we looking at ROI for subscription or other model recovered in year 1 or 2?
All right, maybe Amar and I can take that together. So I think it's a question towards the course fee. So I think one of the aspects that we see when we deploy adaptive learning more broadly is what you will be seeing, not only the benefits of the, I would say, the software data that you see here, uncovering unconscious incompetence, but the time that the group of learners will be spending, that is significantly at an average level reduced. So look at it potentially this way. If you have what a traditional e-learning system would, give learners maybe 10 hours where they will be going through the content to get through, that's same content curated in an adaptive way would typically allow for 50% reduction of time to mastery, not just completion, but actually true mastery. So the organization not only gets the 5 hours per employee back in productive time, but also an employee or a staff member that is proficient in that training that they were sent to. So the ROI often in the discussions that institutions have with us and partners when deploying adaptive learning at scale can be around different metrics. One could be time. If time is less important, so let's say 1,000 health providers are saving 50% of the time where they traditionally would be spending 10 hours in a time fixed course. Now they will be spending half that amount of time, frees up organizational time. It could also be the importance of the 100% competency check that will be delivered with a system that is mastery based and not time and commitment based. So you can spend, as the example, 8 minutes or 33 minutes. The goal is to get you proficient. And that's the promise that a system such as an adaptive learning system gives.
Well, and it's a combination of content as well, right? So I think it's important to ensure that the system as a whole is the base infrastructure, but the content that you create has to be equally impactful and entertaining in the process. And on top of all of that piece, so you have a reduction of time, commitment of time of an individual learner, you have the potential to be able to get them through the organization faster. So you're not paying them as much, right? So you actually save money as a positive ROI because your throughput is better. You're not having to invest as much time, energy, and effort. You're decreasing the faculty requirements and cost. At the same time, what you're doing is creating a longer term mastery ability. And then there's also a data element that's important here. And that data element is you're learning a little bit more about your learners than doing rote learning, right? So if I was doing a level 1, level 2 rote learning where it's death by PowerPoint in a presentation, or simply attending a group of online trainings that are lecture driven, what I know is what students tell me. I don't have data to support customization of content or education that allows for me to be able to ensure that they have mastery quicker, right? So if you notice 50% of your individuals are messing up a certain benchmark built into into a question. Like they're getting a certain element of the question wrong. They're unable to interact. They don't understand the video content. They're unable to define it. And the system is trying everything it can to do that, and they're still getting it wrong. And you're noticing a lot of your students do that. Either you have the questions wrong or the process wrong, or you don't have the ability to be able to actually understand where the gap is, right? So I think, so, I think that in addition to that question, I think, Rob, you were asking about higher education and ROI. It is actually important in academic, because where I think we'll challenge you to say is that if I can increase the ability for a class to be able to graduate more students faster over time, it's more money for the institution. At the same time, if I can offer more programmings at a faster pace or help individuals pass at a higher rate, if I can get a higher NCLEX passing score, then it puts you less in danger, it increases your ability to get greater fundings and achieve research dollars. And so I think there's a lot of opportunity here when we talk about online education and learning, and we mix simulation into that mix as well.
Yeah, thank you, Amar. And I think maybe that also relates this part of, besides the cutting time and don't waste the time of the learner. If time is not of that importance, as Amar mentioned, getting more people through, this is some of the research that is more and more coming out now from adaptive learning and our platform. In this case, this is a board prep product for internal medicine, where just recently published in September, the average passing rate for physicians not using the adaptive learning product version that was tested had a just below 86% pass rate, just below 96% pass rate if used adaptive learning. So significant, and this was a significant finding, 10% increase. Not only that, there was a 10% higher chance for being in the top 10%, top quartile, and 10% less likelihood to be in the bottom. So you not only move the top more, you also move you away from the bottom performers. And that kind of evidence is also what obviously institutions are asking for when they ask what kind of evidence is there around performance and outcomes. And obviously that's different between the US, Canada, rest of the world, but it's certain outcomes, whether it's time, whether it's pass rate, whether it's dropout rates. It depends on obviously the local situation, what is the outcome that you are looking for. But the bottom line is that it's a more efficient and effective way to deliver knowledge, freeing up, as I mentioned in the beginning, time for other aspects of this four-dimensional education model. And this is the last slide, and then I'll hand it over to Kelly so you can get ready with the demo. Ultimately, the goal here is to, most of the CME education that is out there, the focus is declarative, that you've done your CME or you've done some continuous education. The goal here, hopefully, I think we've made clear, is that you need to master what you're trying to go through. So it's a competency and performance-based model, much more than a I've committed to do something. Hence, you can also then use that model in more high-performance environments where you also need to then deliver in other settings, such as simulation settings. So I'll stop here and then hand it over to, I don't know if it was you, Amar, or Kelly directly.
Well, we'll jump on a poll
questions,
real quick. So as you're kind of ramping up for the next poll, there was certainly a question with regards to, for Kieran, there was a question about characters. If you can talk a little bit about characters in the element of adaptive learning. I think they were just looking for clarification. It's part of one of the earlier slide.
So if it's the element of character building, that's obviously more soft areas, such as how do you monitor and actually further develop motivation or grit or persistence. When we go through the live demo, Kelly, I would ask you to show examples of where you can actually see in a progression of a course where a learner may be struggling, and the system, as a good teacher, when it senses that Coram here or Amar needs more attention to a certain learning objective, then that is one of the areas where especially the character building gets involved. That was my 4-year-old, by the way, who ran behind me. So there are different elements that helps hone in on curiosity, mindfulness, grit, to basically help motivate the learners through the course.
Great. So we have results from the poll. So training gap, certainly I think overwhelmingly it's access to content, a system to deliver and tracking our participants' performance, right? And I think one of the things that we're trying to highlight here is that we're not saying that adaptive is the only solution to this mix. I think it's important to know that, as we noted at the beginning, it's you have to have an element for online education. You have to have an element for some level of believe it or not, augmented mixed or virtual reality is now playing a pivotal role, and you're seeing more and more of that technology drive that motion forward, especially from a understanding of gaps in skills and teaching you where things are supposed to be in a digital spatial area. And then simulation, virtual simulation plus in-person simulation experiences. And really the combination of the three is where I think you have to overlay. So overwhelmingly though, it's interesting to see that the training gap is all of the above. Although I don't know if you guys are surprised with it. I'm not sure I'm surprised with it at all. Great. So we're gonna real quickly just talk to, so working with the Area 9 group, CAE certainly has launched more content for you guys to be able to have access to for your learners. You have 2 ways of accessing it. If you go to www.caehealthcare.com/adaptive, it'll take you directly to the adaptive page. You can also go to caehealthcare.com, click on education, and then you would click on this digital learning. From there, you're going to see basically content on the bottom of the page there, and you can click on this little middle blue bar to access the course catalog. And then you'll see certainly pricing is there. It's part of our e-commerce platform and package. And so you'll be able to actually purchase and immediately get access to the content and move forward with completing it. If you're looking for bulk purchasing or pricing, certainly reach out to us. Email at the beginning was training@caehealthcare.com, and certainly we can work with you on the bulk pricing or bulk purchasing of content. So once you're in the system, and we'll get into this a little bit more in detail, but you'll be able to see your course in a queue. You'll be able to see an individual performance, and then the transcripts are present, and then you'll be able to see who is logged in. In this case, it's likely to be you or your student. And the nice thing is, and Kelly will focus on this, you have a coach, you have assessments, you have content that's present there, you see your progress in the education that's present, as well as where you are, right? What's your history, what information you want, how are you progressing in the program, and so it really is adjusting to you, and it understands where your own certainly your own gaps are. So I'm going to switch shares. You're going to see me move over to the digital to the web page, and then I'm going to also certainly fix one thing here. Oh, great. And so you will see, if you went on the page, here's the entire list of courses as you log into our LMS. And so that was one of the other big launches for this week, is that CA launched an LMS. And so certainly you have a lot of education and training here, as well as each of our programs are accredited for CEs. So for the non-academic side, if you're a clinician or a provider, you can get either 1 hour of respiratory care CE or 1 hour of board of nursing CEs for these courses per each course that you complete. And then I'm going to hand this over to Kelly.
Thank you, Amar. So what you're seeing right now on the screen is actually inside of one of those courses. So we're inside of the advanced mechanical ventilation course. And when we first put any learner into a module, we give them just a little bit of an introduction as to what this adaptive experience is going to be like. That's a bit different. So we'll walk them through the way that we're teaching using the adaptive learning, how the system is going to work by asking them questions to really hone in on what are the things that they know and they don't know in order to maximize their time spent in the system to focus on the things that they really need to learn. Some of the specific things just to identify here on the screen before I show you some of the content. As Amar mentioned, there's a coach here that provides some auditory information as people are going through the content. So whether it's slide-based content or we have some interactive content, there's some additional context that's provided by the coach here. And so both of those elements are kind of working as dual channel processing as learners are going through the course. There's also the ability to have a set your self-assessment. And what this really does for the learners is allow them to tell the system how they want to be treated. If they're totally new to the material, starting with a lot of questions about things they don't know can become really frustrating. And so by setting this at more of a beginner stage, the system is going to treat them as such. So show them a little bit of content first and then see how they're processing that. Are they understanding it as they move through? And then progress them through the content sort of in that fashion of showing some material first before moving into a lot of the questioning, versus somebody who says that they're an expert and really just wants to be able to validate their knowledge is going to be asked a lot more questions and then can opt into the content themselves as they go through and maybe have anything that they do. So as we move through, I'm just going to switch back over to this view. Learners can see their path through the materials. So this is, of course, personalized for every person who's going through. This history here is going to look a little bit different. And what we're really tracking there is the completion across the learning objectives of the course. So what are all the things that we're asking this learner to know at the end, and how far have they gotten in completing that learning specifically? Herm had mentioned about some of the character elements, which we track here as well. The grit score is one of those specifically. So if I'm answering questions incorrectly, is my grit score, am I going in to look at the content and really take the time to learn that material? That's going to cause my grit score to go up over time. The same is true with your knowledge and your meta learning. As I'm answering things more correctly, my knowledge score would go up, and my meta learning is my awareness of my knowledge. So maybe there are some things that I don't know, but I know that I don't know it. And that is tracked through here as well. And then we can always see for each individual, knowing everybody is busy and it's hard to get a solid period of time to potentially get through a learning like this. You're able to leave the system at any point in time, but we can always give you an approximation of the amount of time that you have left to complete the module and how far you've reached on your journey to 100% competency of the material that's being presented. The experience through the platform is pretty straightforward from a learner perspective, as far as being pretty intuitive. I'll move into some of the more specific content. Some of the introduction. The learning resources that we use are oftentimes interactive. There's a lot of material that can be presented. So we always want to make sure that after we've presented information, we give the opportunity for the learner to tell us, did you already know this? Do you understand it now that you've read it? Are you a little bit unsure at this point, or do you really not get it? And that gives the adaptive algorithm that's running the experience for the learner a little bit more feedback as to, do we need to come back around to questions on this to make sure you really understood it? Or maybe I would use a more advanced question if I knew, if you went through and said, I already knew this, we can just validate it.
It's a webinar that I'm not even listening to.
Okay, I've got
so as you can see, the learner can interact with the material.
I just gave him an update on something. Is he?
he was afraid to do anything.
I'm gonna mute.
Oh,
I've got him. So
Here.
Okay.
Here. Sorry about that. This coach text can autoplay. We have that turned off right now, as that can be difficult to talk over, but as the learner's going through, that'll jump on and kind of give some additional context to the material as they're going through it. The learning experience then progresses from here based on how I respond to the content that I'm being presented with, and then eventually I will see some questions. We utilize a lot of different question types through the program. including multiple choice, fill in the blank, and again, some interactive questions where we ask a learner to perform a specific task as they move through material. And I believe we have some of those here that I can show as well. As you can see, you can always jump through or forward to any other information rather than stepping through the content in the adaptive algorithm. So if you want to come back in and take a look at anything, you're able to do that at any time as well. So we have a built-in refresh that's actually part of the course also, but if you want to come back in and look at any material again later, you can pull it up through this table of contents. And I think I'll pause there. Amar, is there anything else you'd like to add around the content specifically, or the way that the material was developed?
Yeah, so I mean, we certainly in this first push to really meet a growing demand for COVID, that much of the content that you'll see loaded in the system straight out the gate for everybody to use, because this is what we hear constantly, is ventilation related. So basic and advanced ventilation, COVID specific ventilation, and then a ventilation reskilling course, which is probably the one that has early in the COVID process grown the biggest feet and legs. And then we have curriculums that are built around mechanical ventilation specifically right now. We're constantly looking at new content and curriculum, working collaboratively with Kuram and Kelly, advancing that, if you will, fast and furious, right? So, or as fast as possible. And, but certainly open to ideas on things that you guys are looking for or have gaps in that need support and help with, right? Our hope is that we're providing you and your learners with the accessibility that drives ease of access, ease of use, reduces time in the classroom space where possible, and certainly this digital content-rich environment is what we're hoping for. So if the content makes sense, our hope is to be able to provide it to you. So with that said, let me, anything else on your side, Kelly?
No,
Okay.
unless there's any questions or anything I can revisit.
So I'm gonna switch back over to the, so actually let's pause there for a second. Is there anything anybody wants to see specifically? So there's a question sitting in the chat: what platforms can one use to complete these adaptive training courses? Oh, so is this computer friendly, tablet friendly, phone friendly, etc., right? So the answer to that question is yes, right? So it is mobile friendly for all intents and purposes, right? So you can log in, register, and utilize a portable device. We're certainly using a PC in this case. What you don't see in the background is I have a Mac that's mirroring this just the same. So we tend to test it across all platforms and as well. So.
There's also a question around, can you show what the student sees in terms of personalized feedback? And we can, so basically, depending on how the student is answering, especially the self-assessment items, I know it, got it now, think I got it, I don't get it, in the bottom part of every learning resource or question, the thing that the learner will then see depends on how they are self-assessing, so what their metacognition level is. And they could get, for example, a micro remediation if they said that something is I know it, but they got it wrong in a question, then there will be something that remediates that specific misconception as an example. Maybe we can show that. I don't know if you click "New" on the.
So
let's go through a few questions just to show an example. I don't know if you have time, but.
There it goes. Okay, so let me use this one as examples. Lungs become, I'm going to make up a number, pressurized, right, at high volumes and high pressures, right? And I'm going to say I have no idea. So there's the remediation element, right? The answer is stiff. It told me I got it wrong. And then certainly it pointed out the fact that I didn't, and it gives me the option of remediating. So now I can learn more through pulmonary compliance. Because the system is constantly adjusting, it's going to eventually force me to answer this question. And there is no 80%, right? It is 100 or 0. There is no, you can't complete and get a certificate at 50%, right? So it expects performance to be well. So if I, continue
if you
down
click that, yeah. Oh,
an error there. So let's keep going here. So and then certainly if I keep going through different areas, right? So let me skip ahead here. This is the one Kelly was talking about. So if I hit I don't get it, it's basically explaining why. Right? It's just asking you for asking you to help us to help get the resources designed, right? So
in this example, we will, as a content team, will actually get that even this resource, this remediation is not helping the learner, then that information will be used to update the content constantly. So it's a precision approach to rapid content development so that we target and focus the resources to the areas where we either have data directly from the learners, so crowdsources, or we can see that these top 10, 20 learning objectives are the areas where learners are actually struggling. So the efforts will be put to improve that part of the content. And as the courses are cloud-based, they keep being updated. So when the next learner logs in, it'll have updated content.
And then you're seeing a coach that's reading the definition here in the interactive, right? So I turned it off just because it was in the background here on the computer that you guys don't hear. But you can have a narrated coach, you can read it just the same, and then it's certainly walking you through the graphical representation of time. So good question. So let me reshare this slide set real quick so we can certainly open up the floor a little bit more for some Q&A. And so, certainly one point I'll make, I know that we're a bit short on time running out here, is our next session is listed for November 4th at 2 p.m. We're going to focus on model physiology for the virtual patient. So, why model physiology really makes sense in education and training and when you're using it, especially in this digital spectrum. So we welcome you to be able to join us for that session. We do have a poll question as we're opening the floor up for more Q&A. What type of content do you need for your program, right? So kind of an open question out there, curious of what you're really looking for and struggling. I certainly saw a note in the chat about the need for standardized patient education and training. I think that makes logical sense. Faculty development certainly is always a big one that often pops up, but we're certainly curious of what you need to ensure that we're creating that customized experience for you. So with that, what questions, kind of open the floor up a little bit, what questions can we answer for you additionally? I have one for Kira. Where do you see the future? Right. So where is this taking us, right? We're COVID crisis now, and certainly you're seeing, I'm sure you're seeing lots of effort around adaptive learning. What does that future landscape look like?
So I think it's the partial fragmentation of training that I started the call with around how we can actually combine those things. So right now we are launching together specific adaptive learning courses, but you also have a lot of other learning modalities, VR, AR, simulators, and then the traditional teacher with its students. How do you actually combine all of that together in one system that can be tracked and then, follow people's competencies over a longer period of time? So it's not, kind of one event learning, whether it's a simulation event or an adaptive learning. But I think to get there, you need all the pieces to start, being available. And then it's also from institution to institution, easier to see what fits in this setting, in this culture. And then I think over time, I'm sure that you will also, and everyone on the call will find the way that is most configured and custom to a specific institution's needs. So it will be less, I think, standard solutions, but even further custom solutions based on these modalities of learning.
Well, I think the digital ecosystem is we've come a long way in 6 months, right? Who would have thought we would have been hosting virtual conferences and all these other things that are happening right now? I think adaptive is going to weave its way into mixed reality. I think we're already starting to see that notion pop up pretty fast and furious in some engines. I'm kind of curious, of the larger masses of what they think about adaptive elements in their content in simulation technology. So what if a course itself that you've created, I mean, there's some level of if-then statements that you're building into the content you're creating for mannequin-based technology, right? I think we all have done that where if they zig, then you zag, right, type of a thing. But, true adaptive segmentation still requires a true physiology engine on the back end to build that, but there's not an AI component yet. And I do think that that's probably going to become that future of AI, of where starting education is really going to be driven by that nature. I mean, I think you're starting to see it because you mentioned four-dimensional, right, work in some of these things. So
there's a good question here from Ernesto. What would you say are the biggest technological limitations standing in the way of achieving greater pedagogical gains? I have to think a little bit about it, Amar. If you
adoption.
Yeah.
I don't necessarily think it's a technological
that was my
limitation.
That was my initial. I think it's more. Of course, there's technical limitation if there's no internet. Actually, our adaptive platform can also be very soon be accessed offline in periods up to at least some days, and then you sync up. So I think it's more like organizational and culture. As you all know, with simulation, it took time, and once it's embraced, it goes through a system, but you still need to keep honing the skills to implement it. Now there are new technologies in place, so combining those, looking at the science, the evidence, and how to combine those things, and the training to be able to do that. I think that may be the biggest barriers, to make sure that people get trained in how you combine these things into that framework of four-dimensional education.
And I live in this ROI world, right? And I think one of the comments that was put in the chat is especially the cost, right? Paying for it is how do folks, you have to see value in it to be able to see it. And I think the ROI structure around this is framing it so that you can actually look at the data set and drive efficiencies and outcomes and better competencies, right? So the adoption is driven by data to support the technology, which is then adopted within the organization to create better outcomes for organization. But for those that have heard me talk about ROI and financial structures, you got to walk the walk and talk the talk to the right people that are walking the walk and talking the talk, right? So you got to speak like a CFO if you're talking to the CFO. You got to speak like a CEO if you're talking to the CEO, but you got to have data to support it. And one of the best slides you have in there is the 50% drop with the 100% competency. That's significant, right? When you think about creating an ROI and a positive return, right?
Yeah, that definitely speaks to the CFOs, right? Saving time, saving cost. I think there's another grant opportunities. Actually, we have seen that also as a way to drive, because a lot of grants want innovative technologies to provide better learning outcomes. And so I'm sure if you look at the various courses available and you seek grants and highlight the innovative and evidence-based part of the solutions, maybe for some getting grants to pay for it is also a way if the CFO is not convinced.
Yeah. Yep. Well, and we've been lucky between Canada Digital Supercluster grants in the U.S., CARES Act funding. I mean, there's been some good movement internationally. We've seen some other digital supercluster fundings popping up for organizations, especially in this massive pivot. It wasn't an easy pivot for anybody, right? And so I think there is some opportunity for funding to upgrade facilities. My old alma mater, as an example, certainly went to digital completely in the classroom, but still had classroom settings. So they're doing both simulcasting, but they weren't set up for that, right? And they had to back end and retrofit that and create that. And that's one of those times where you can say, look, let's change the technological delivery landscape as well, right? Is classroom-based orientation the best way to do this? Or can I roll out a different type of an educational program and a methodology to be able to drive that? So Great. So one of the questions is the recording available? So yes, the recording will be posted online at the end of this, and once it consolidates in Zoom, the folks from the Society for Simulation in Healthcare, our thanks to Judy and Olivia for all their works. It will certainly get it posted online and shared for you guys. All right.
Thanks, Amar.
So a few minutes left in the note. Any other questions? Awesome. Kira and Kelly, our thanks for jumping on today and certainly being part of this this session and certainly sharing all of your work and our collaboration. We very much appreciate everything that you're doing with us and together. So thank you for everything there.
We thank you. Thank you. Thank you, everyone, for listening.
Thanks, guys, for jumping in. We look forward to seeing you on November 4th at the next session. Thank you so much. And thank you, Judy and Olivia.